Have you seen recent headlines about diphtheria outbreaks? In Edo State, Nigeria, authorities confirmed that 4 people have died from diphtheria between 2024 and May 2025. The resurgence of this disease is raising urgent public health concerns. Diphtheria is a serious bacterial infection that mostly affects the nose, throat, and sometimes the skin. It's caused by a bacterium called Corynebacterium diphtheriae, which produces a toxin that can lead to life-threatening complications such as heart damage, nerve injury, respiratory distress, and death if untreated. One of its key signs is a thick, grayish-white coating in the throat or on the tonsils, which can block breathing. Before the introduction of vaccines, diphtheria killed thousands worldwide each year. While rare today in many countries, it's resurfacing due to weak healthcare systems, displacement, conflict, and declining vaccination rates. Diphtheria is highly contagious and spreads through coughing or sneezing, close contact with infected people, contaminated objects like utensils or bedding, and in rare cases through skin lesions. People can carry the bacteria without symptoms, making it easy to transmit unknowingly. Symptoms typically appear 2 to 5 days after exposure and include sore throat, difficulty swallowing, swollen glands, hoarseness, low-grade fever, weakness and fatigue, and a gray or white coating in the throat or nose. In severe cases, the diphtheria toxin can spread through the bloodstream, leading to heart inflammation, nerve damage, paralysis, and breathing failure. Skin diphtheria, more common in tropical areas, causes painful ulcers or sores. Several factors contribute to new outbreaks. Low vaccination rates. When fewer people are vaccinated, herd immunity weakens and the infection spreads more easily. Conflict and displacement. Wars and migration disrupt access to healthcare and vaccines. Overcrowded and unsanitary living conditions. Refugee camps and slums allow infections to spread rapidly. Weakened immunity. People with malnutrition, HIV, or chronic illnesses are more vulnerable. Lack of awareness. In areas where diphtheria hasn't been seen in years, people may not recognize symptoms until it's too late. High-risk groups include unvaccinated children under 5, adults over 60 without recent boosters, people in crowded or unsanitary environments, healthcare workers without protective equipment, travelers to outbreak zones, and immunocompromised individuals. Prevention is key when dealing with diphtheria. Vaccination is the most effective measure. The diphtheria vaccine is usually given as part of a combination shot, DTaP for infants and children, and TDAP or TD for teens and adults. Children begin their vaccine series at 2 months of age, with boosters through adolescence and every 10 years in adulthood. Good hygiene practices are essential. Wash hands frequently. Avoid close contact with sick people. Disinfect commonly touched items and wear face masks if advised, especially during outbreaks. If someone shows symptoms, they should get immediate medical attention and be isolated to prevent further spread. Treatment works best when started early and includes 2 major approaches. Diphtheria antitoxin neutralizes the toxin but does not kill the bacteria. It must be administered promptly to prevent complications. Antibiotics such as penicillin or erythromycin are used to kill the bacteria and stop transmission. Additional care may include breathing support, IV fluids, and heart monitoring. Patients are usually kept in isolation for several weeks. Close contacts may be given preventive antibiotics, even if they show no symptoms. Without treatment, diphtheria can be fatal. The World Health Organization estimates a fatality rate of 5 to 10% and up to 50% in untreated cases, especially among young children and the elderly. Complications include airway blockage, heart failure, permanent nerve damage, paralysis, coma, or death. By staying informed, promoting vaccination, and acting early when symptoms appear, we can protect ourselves and our communities. Stay safe, stay informed, and take care of each other.